Prevention is better than cure. This is a well-proven and commonly taught lesson in all subjects of medical sciences. What are the practices that can help us to contain and control this virus? This virus is now considered to be highly transmissible. I invite Dr. Benin Rajesh, who is a resident in the Department of Medicine, for the talk. I am thankful to Dr. Prayas Sethi for being the preceptor. Over to Dr. Benin.
Our objectives in this webinar is to learn about the prevention in the community, prevention in the healthcare setting, and regarding vaccines and pre-exposure prophylaxis in the context of COVID-19. First, going to prevention in the community. The key points are practicing social distancing, hand hygiene, respiratory hygiene or cough etiquette, cloth face coverings to avoid touching the face, and cleaning and disinfecting objects and surfaces. Practicing social distancing is essential because the main modes of transmission of COVID-19 is through respiratory droplets and by contact routes. So what is droplet infection? When a person coughs or sneezes, respiratory droplets are produced which can travel for approximately up to a distance of 2 meters or 6 feet. And when these droplets land on a person in close contact, they are at risk of having the mucosae, that is in their mouth or nose or conjunctiva, exposed to infective respiratory droplets. One can practice social distancing by staying at home as much as possible. When one has to leave home, they have to maintain a distance of 2 meters, that is about 6 feet from each other. Hand hygiene prevents the contact routes of transmission by direct contact with infected people and by indirect contact with fomites. Washing hands with soap and water should be done, covering all surfaces for at least 20 seconds. This should be done particularly after touching surfaces in public. An alternative to hand washing, when the hands are not visibly dirty, is to use a hand sanitizer that contains at least 60% of alcohol. Communities should be encouraged to practice respiratory hygiene or cough etiquette to minimize droplet spread. One should cover the mouth and nose with a handkerchief or paper tissue while coughing or sneezing. After coughing or sneezing, these tissues should be discarded in a wastebasket and handkerchiefs washed every day. When one does not have a handkerchief or a paper tissue, one should cough into the upper sleeve or elbow. It is also essential to perform hand hygiene after coughing and sneezing. Using cloth face coverings is essential as a significant portion of individuals affected with coronavirus are either asymptomatic or pre-symptomatic. Virus can spread between people when they interact in close proximity. Cloth face covering should be used especially when in public settings where social distancing is difficult to achieve. For example, in grocery stores and in pharmacies. One should avoid touching the eyes, nose or mouth when removing the covering and practice hand hygiene after using it. It should also be washed routinely. The Ministry of Health and Family Welfare has provided advisory regarding making and maintaining cloth face coverings in their website. Many states like New Delhi, Uttar Pradesh, Maharashtra, Chandigarh and Odisha have also made it mandatory to wear masks or cloth face coverings in public. Various leaders have also appealed to the public to use cloth face coverings. It is also essential to avoid touching the face, especially the eyes, nose and mouth. Cleaning and disinfecting of surfaces that are frequently touched, for example, tables, doorknobs, light switches, handles and desks should be done regularly. The steps are as follows. First, one should wear disposable gloves and clean the surface with soap and water. Following this, disinfection should be done. This can be done using household disinfectant, which is available from various brands, diluted household bleach solutions, or alcohol solution with at least 70% of alcohol content. Here we'll briefly look at how a household bleach solution can be prepared. This can be prepared by either using sodium hypochlorite solution or using bleaching powder. Most of the organisms are killed when it is used in a strength of 1 to 3% with a contact time of 10 to 30 minutes. In this first table, we see how household bleach solution can be made using sodium hypochlorite solution. And in this next table, we see how it can be prepared using bleaching powder. The prevention in the healthcare setting can be divided into the following subcategories. That is, regarding measures for all patients, infection control for suspected or confirmed cases, exposure in healthcare workers, and environmental disinfection. Environmental disinfection should be done based on local hospital infection control guidelines. First, regarding measures for all the patients. All the patients should be screened for clinical manifestations consistent with COVID-19 prior to entry into a healthcare facility. If they are found positive, they may warrant additional infection control precautions and testing. Patients with respiratory secretions and symptoms should be provided separate waiting areas. In location where community transmission is ongoing, it is prudent to postpone all elective procedures or non-urgent visits and use virtual, that is, tele-video communication visits. Individuals who are suspected to have infection should be advised to wear a face cover prior to seeking medical attention. Next, we look at the recommendation provided by two major bodies, that is the WHO and the CDC. The WHO recommends standard contact and droplet precautions, that is a gown, gloves and medical masks, and to wear eye or face protection. An addition of airborne precautions, that is a respirator, should be used during aerosol generating procedures. The CDC recommends a single occupancy room with a closed door and a dedicated bathroom. Airborne infection isolation room or a negative pressure room should be provided for patients undergoing aerosol generating procedures. Personnel entering the room should wear appropriate personal protective equipment, which includes gown, gloves, eye protection and a respirator. A special attention to the appropriate sequence of donning, that is putting on, or taking off, that is doffing PPE, is essential to avoid contamination. Instructions for donning and doffing PPE can be found in various websites, including the CDC's. Regarding exposures in the healthcare workers, all institutions must maintain a low threshold for evaluating symptoms and testing symptomatic healthcare personnel. First, let us define a few terms. Close contact. Close contact can be defined as being within approximately 2 meters of a person with COVID-19 for a prolonged period of time, or having unprotected direct contact with infectious secretions or excretions of the patient, for example, being coughed on, touching used tissues with a bare hand, etc. The definition for prolonged exposure is unclear due to insufficient data. Currently, more than a few minutes of exposure is considered as prolonged exposure. Self-monitoring. Monitoring of fever should be done by measuring temperature twice a day, and healthcare personnel should remain alert for symptoms of COVID-19 like cough, shortness of breath, sore throat, etc. Work restrictions are based on the risk categories described in the guidance by the CDC, which we look in the following slides. In the following table, we'll see how the exposure categories are defined and work restrictions are advised for asymptomatic healthcare personnel. Following prolonged close contact with a COVID-19 patient, we need to take into account the personal protective equipment the healthcare personnel was wearing. Based on this, the exposure categories of high exposure, medium exposure, or low exposure is defined. Healthcare personnel falling under the high and medium exposure category are advised restriction from work for 14 days after the last exposure. This table also shows how the high exposure category is defined and the work restrictions. Numerous vaccine candidates are being evaluated for COVID-19 and preliminary studies in humans are underway. Various targets are being considered using various platforms. The time frame of when a vaccine will be available for use in the general public is unclear. It may take about 6 to 18 months or maybe even longer. There was interest in BCG immunization for COVID-19 infections. This was because studies had shown that BCG immunization induces a non-specific immune response which may have a protective effect against non-mycobacterial infection, including viral infections. The impact of BCG immunization on COVID-19 specifically is unknown, and the WHO does not recommend BCG vaccination for the prevention of COVID-19. Regarding pre-exposure prophylaxis, the National Task Force for COVID-19, constituted by the Indian Council of Medical Research, recommends the use of hydroxychloroquine for the prophylaxis of SARS coronavirus 2 infection for high-risk population. Two groups of individuals fall under the high-risk population. They are asymptomatic healthcare workers involved in the care of suspected or confirmed cases of COVID-19 and asymptomatic household contacts of lab-confirmed cases. The dosing of hydroxychloroquine is as follows. Asymptomatic healthcare workers involved in the care of suspected or confirmed cases of COVID-19 should take 400 mg twice a day on the first day, followed by 400 mg once a week for the next 7 weeks. Asymptomatic household contacts of lab-confirmed cases should take 400 mg twice a day on day 1, followed by 400 mg once a week for the next 3 weeks. It should be noted that hydroxychloroquine should only be taken after being prescribed by a registered medical practitioner. A known case of retinopathy or known hypersensitivity to chloroquine are contraindications for taking this drug. It is also not recommended for prophylaxis in children under 15 years of age. While prescribing hydroxychloroquine, one should also remember that the recommendation states that it is only supported by preclinical data and it is based on a limited number of available studies, risk-benefit consideration, and under exceptional circumstances that call for the protection of high-risk individuals.
The world has tried all possible ways to prevent this infection, but so far only social distancing and care of personal hygiene have shown its utility. Lockdown has proven to be very efficacious in flattening the epidemiological curve, but as you know, there is no free lunch in this world. And now there is increasing concern regarding the high price which we are paying for it. We request you to post your opinion regarding the various preventive strategies which you have followed so far in controlling this disease, which among them you think were doable and which of them are difficult to follow. We are eagerly waiting for your responses. Please do post your queries and your responses in the comment box. We would be happy to address them. Friends, we need a drug that can effectively cure the disease and a vaccine that can prevent the illness very effectively, especially to our vulnerable population. This is going to take some time. How long? Only time will tell. Till then, maintain social distancing and personal hygiene.